Welcome back. This is Dr.Habiburrehman. We are going to discuss the second portion of peptic ulcer lecture. In this second portion of peptic ulcer lecture, we will discuss the clinical features and we will discuss the management. We will discuss the types of peptic ulcer. So first I will explain the clinical features of peptic ulcer. There are clinical features of the peptic ulcer include pain, nausea and vomiting, and hematemesis. The clinical feature includes three main things: pain, nausea and vomiting, and hematemesis. Here we will talk in detail about the pain. First of all, we will discuss about the pain in detail. What is the site of the pain? So the pain occurs in the epigastrium. I should explain here that what is epigastrium. Our abdominal cavity is divided into 6 parts, 6 areas. I should try it bigger so that you can see. Our abdominal cavity is divided into 6 parts. This part is called epigastrium. This one is called hypogastrium. This one is called right hypochondrium. This one is called left hypochondrium. This region is called right lumbar region. This one is called left lumbar region. This one is called umbilical region, and this one is called right iliac region, and this one is called left iliac region. Our abdominal cavity divided into 6 parts: right hypochondrium, left hypochondrium, right lumbar, left lumbar, right iliac, left iliac, epigastrium, umbilical, hypogastrium. So now we come to know that this area is called epigastrium. After the site, we will discuss the character of the pain. What is the character of the pain? It is burning type sensation. Burning type sensation. Now we'll talk about the time of pain. So now it is different in the peptic gastric ulcer and duodenal ulcer, the time of pain. In the gastric ulcer, and duodenal ulcer, the time of pain is different. In the gastric ulcer, when the patient take the food, so after 15 to 30 minutes, he or she will feel the pain. But in case of duodenal ulcer, when a patient takes the food, so after 2 to 3 hours, patient will feel the pain. After the time, we will talk about the relation with the food. What is the relation with the food? Again, it is different for gastric ulcer and for duodenal ulcer. If the patient take the food, the patient will feel the pain. In case of gastric ulcer, but if the patient take the food, in case of duodenal ulcer, the pain will be relieved. So this is relation with the food. Now we will talk about the aggravating factor, that what are the factors which increase the pain of peptic ulcer, and then we will talk about the factors which decrease the pain. So first I will talk about the aggravating factors. The pain can be increased with the alcohol intake, coffee, tea intake, spicy food. Again here, aggravating factor, the intake of food will increase the pain in case of gastric ulcer, and missing of food will cause the pain in case of duodenal ulcer. Aggravating factors: alcohol, coffee and tea, spicy food, all these will increase the pain. But here is a little bit conceptual. Intake of food will cause the pain in case of gastric ulcer, and missing of food will aggravate the pain in case of duodenal ulcer. Now, what are the factors which decrease the pain? Relieving factors. So it includes the milk, antacids, and opposite, as we discuss in aggravating factor, vomiting will relieve the pain in case of gastric ulcer. The relieving factor, vomiting will relieve the pain in case of gastric ulcer, and intake of food will relieve the pain in case of duodenal ulcer. Let's have a review. We are talking about the peptic ulcer clinical features. So the clinical features include pain, nausea and vomiting, and hematemesis. Now we talked about the pain in detail. What is the site of pain? Epigastrium. What is the character of pain? Burning sensation. We talk about the time of pain. So in case of gastric ulcer, when the patient take the food, so after 15 to 30 minutes, the patient will feel the pain. In case of duodenal ulcer, the patient will feel after 2 to 3 hours, he or she will feel the pain. Now we talk about relation with the food. So in case of gastric ulcer, when patient take the food, he or she will feel the pain. In case of duodenal ulcer, when take the food, the pain will be relieved. Now we talk about the aggravating factors. It is alcohol, coffee, and tea, spicy food. Intake of food will increase the pain in case of gastric ulcer, and missing of food will increase the pain in case of duodenal ulcer. Then we talk about the relieving factors. So it includes milk, antacids, and vomiting. Vomiting will relieve the pain in case of gastric ulcer, and intake of food will relieve the pain in case of duodenal ulcer. And the second clinical feature is nausea and vomiting, and the third is hematemesis. So remember that sometimes the patient will have no pain. He or she will only be presented with the sign and symptom of anemia due to the chronic blood loss. It is called hematemesis, and it is because of the perforations of ulcer. This is all about the clinical feature of peptic ulcer. So after the clinical feature, now we will talk about the difference between gastric ulcer and duodenal ulcer. I will write in a tabulated form. So the difference between duodenal ulcer and gastric ulcer. First of all, the duodenal ulcer occurs in the first part of while gastric ulcer occurs in the lesser curvature antrum or junction between antrum and body of stomach. So one difference is the location difference. The duodenal ulcer occurs in the first part of duodenum, and gastric ulcer occurs in the lesser curvature of antrum or junction between antrum and body of the stomach. Another difference, first of all, I should tell you what is antrum. Our stomach consists of three parts: fundus, body, and this part is antrum. The stomach consists of three parts: fundus, body, and antrum. So the gastric ulcer occurs in the lesser curvature of antrum. Another difference is the duodenal ulcer never be malignant. A gastric ulcer may be malignant. The third difference, duodenal ulcer are more common, gastric ulcer are less common. In case of duodenal ulcer, risk factors include the H. pylori, NSAIDs, smoking, etc. But in gastric ulcer, the most important risk factor is NSAIDs, and then others like H. pylori, etc. Another difference is the time of pain. In case of duodenal ulcer, the patient feel the pain after 2 to 3 hours after the eating, but in case of gastric ulcer, the patient feel the pain after 15 to 30 minutes after the eating. So one difference is the patient feel the pain after 2 to 3 hours after eating, but in gastric ulcer, patient feel the pain 15 to 30 minutes after eating. Another difference is the aggravating factors. In duodenal ulcer, in gastric ulcer, intake of food will cause the pain. But in case of duodenal ulcer, missing of food will cause the pain. Another difference, in case of gastric ulcer, vomiting will relieve the pain. But in case of duodenal ulcer, intake of food will relieve the pain. Let's have a review. We are discussing the difference between duodenal ulcer and gastric ulcer. So the first difference is the location. Duodenal ulcer occurs in the first part of duodenum, while the gastric ulcer occurs in the lesser curvature of antrum or the junction between antrum and body of the stomach. This can never be malignant, it may be malignant. This is more common, this one is less common. Here the risk factors include H. pylori, NSAIDs, smoking. Here the important risk factor are NSAIDs. Here the patient will feel the pain 2 to 3 hours after the eating. But here in gastric ulcer, 15 to 30 minutes after eating, the patient will feel the pain. Here missing of food will cause the pain. Here intake of food will cause the pain. Here intake of food will relieve the pain. Here vomiting will relieve the pain. So these are the difference between duodenal and gastric ulcers. Now we will go to the investigation of peptic ulcer. in investigation we use different tests are used. Very important one is endoscopy. Endoscopy is the investigation of choice. Another test used is barium meal test, in which we use double contrast technique is used. Another test we used or test for the H. pylori. H. pylori bacteria. Test for H. pylori bacteria includes different tests like serology, culture test, urease test. And other test includes ECG, X-rays, etc. ECG is done to exclude the MI, myocardial infarction. So let's have a review. Investigation, different investigation used here. Endoscopy. Endoscopy is the investigation of choice. Barium meal test. Test for H. pylori. Different tests available for H. pylori, serology, culture and urease test. And other tests include ECG and X-ray. ECG is done to exclude the MI. And one thing you should remember, that urea breath test is one of the tests which is done for the H. pylori, but this test is very specific test. So you should remember the urea breath test for the H. pylori. This is all about the investigations. So now we will talk about the management of peptic ulcer. Management of peptic ulcer. Categorized into two: non-pharmacological and second one is pharmacological. Non-pharmacological include these tips: avoid alcohol, avoid use of aspirin, avoid the spicy food. Now come to the pharmacology, and another thing is smoking. Avoid the smoking, because which is one of the risk factor, as earlier we discussed in the risk factor of peptic ulcer. Now come to the pharmacological, which is very important. there are different categories of drugs which are used to treat the peptic ulcer. So the first group, drugs which decrease acid level. Another group, drugs which increase the mucosal defense. And the third group, drugs to remove or eradicate H. pylori. How to remember these groups of drugs? You should remember the treatment strategy. What is our treatment strategy? Our treatment strategy is 3 points you should remember. First, we are gonna decrease the acid level. Decrease the acid. The second treatment strategy, we have to increase the mucosal defense. And the third is we should remove the bacteria, H. pylori bacteria. So these are the 3 treatment strategies. According to the treatment strategy, we give the drugs, like to reduce the drugs, we give drugs that decrease the level of acid, drugs which increase the mucosal defense, and drugs which remove or eradicate the H. pylori. Now we will talk that what are the drugs which decrease the acid level, what are the drugs which increase the mucosal defense, and what are the drugs which remove the bacteria. So here this includes H2 receptor blocker or antagonist. It includes proton pump inhibitors, and it includes antacids. So these drugs will decrease the level of acids. Now what are the drugs which increase the mucosal defense? Sucralfate, misoprostol, bismuth compound. These are the drugs which will increase the mucosal defense. Now what are the drugs which will eradicate the H. pylori bacteria? So this includes amoxicillin, clarithromycin, tetracycline, and metronidazole. Let's have a review. Management categorized into 2 groups: non-pharmacological and pharmacological. Non-pharmacological, avoid the alcohol, avoid the use of aspirin, avoid the spicy food, and smoking. Pharmacological, again we use 3 different groups of drugs. Drugs that decrease the acid level, which are H2 receptor antagonist, proton pump inhibitor, and antacids. Second group is drugs that increase the mucosal defense, which include sucralfate, misoprostol. You should also know the group is called prostaglandins analog. Prostaglandins analog, and bismuth compound. The third group include the drugs to eradicate the H. pylori, which include amoxicillin, erythromycin, tetracycline, and metronidazole. Now we will talk about each groups of drugs, like we will talk about the H2 receptor antagonist, proton pump inhibitor, antacids, and all the mechanism of these groups. So now we will talk about each drugs about the which help in the treatment of peptic ulcer. So first of all, we will talk about the H2 receptor antagonist. H2 receptor antagonist. What is the mechanism of H2 receptor antagonist? As the name suggests, it blocks or inhibits the H2 receptor or histamine receptor on the parietal cells of the stomach. So the mechanism of action is it inhibits H2 receptors on parietal cells. Parietal cells, they contain different receptors. So here let's suppose this is H2 receptors. The function of histamine is histamine will increase the acid production. Whenever histamine binds to this receptor, it will increase the acid production, and our treatment strategy is to decrease the acid production. So we will block the receptor so that histamine will not release the acid, will not produce the acid. So we give the H2 receptor antagonist, we will block this receptor, so histamine will not cause the cell, the parietal cell, to release the acid. So we will give the H2 receptor antagonist. What are the examples in H2 receptor antagonist? You should remember cimetidine, anitidine, amotidine, and you should know the adverse effect. The side effect of H2 receptor antagonist, especially cimetidine, it will cause confusion in elders, old patients. It will cause impotence and gynecomastia in young. So therefore, cimetidine or H2 receptor antagonists are avoided to give in elders and young patients. Now we will talk about the proton pump inhibitor, another group. What is the mechanism? The mechanism of action, proton pump inhibitors inhibits hydrogen potassium ATPase enzyme Let's consider this is a cell. There is a pump, hydrogen, potassium pump. This pump will push hydrogen ions from cells to the lumen, where hydrogen ions will react with the chloride and will form the HCl. Now, these drugs, proton pump inhibitor, will inhibit this hydrogen potassium pump, so the hydrogen ions will not be released into the lumen, so the acids will not be formed. Examples include omeprazole, pantoprazole, lansoprazole, and esomeprazole. Another drug are antacids. Antacids are actually weak bases. They will neutralize the acid in the stomach. Acid-base reaction, neutralization. So actually they are weak bases. They will neutralize the acid in the stomach and will reduce the acid level. Example includes calcium hydroxide, magnesium hydroxide, aluminum hydroxide, and sodium bicarbonate. Magnesium, now we'll talk about the adverse effect. So magnesium hydroxide is laxative. And aluminum hydroxide will cause constipation. And now we will talk about the drugs which increase the mucosal defense. Drugs which increase the mucosal defense include sucralfate. First we will talk about sucralfate. So what is the mechanism? These are small molecules which will polymerize in the acidic environment of stomach to form polymers. And these polymer will form a coating on the injured area. For example, this is ulcer. So the sucralfate will form a coating over the ulcer. What is the side effect? Side effect, it will cause constipation. Another drug which increase the mucosal defense is bismuth compounds. These compounds will form bismuth protein coagulant, and this coagulant will prevent the ulcer. Another drug which increases the mucosal defense is prostaglandins analog. This includes misoprostol. What is the mechanism? This drug increases mucus secretion and decrease acid production. The side effect is it will cause abdominal pain and diarrhea. And very important point that misoprostol is used as a prophylactic agent in the patient who are taking NSAID to prevent NSAID-induced ulcer. Let's have a review. We are talking about the drugs which increase the mucosal defense. 3 types. Number 1, sucralfate. Number 2, bismuth compound. And number 3, prostaglandins analog. Sucralfate are small molecules which polymerize in the acidic environment of the stomach, and this polymer will form a coating on the injured area of stomach. Then what is the side effect? Side effect is constipation. Then the bismuth compound, it forms the bismuth protein coagulant which prevents the ulcer. The third one is prostaglandins analog, which the example is misoprostol. What is the mechanism? It increases mucus secretion. It decreases acid production. Side effect, it will cause abdominal pain and diarrhea. And prostaglandins analog or misoprostol is used in the patient who are taking regular NSAIDs to prevent NSAIDs-induced peptic ulcer. Hope you learned. This is all about the peptic ulcer. Thank you so much for watching easy to learn production videos.